All right. Well, good afternoon, everybody. It's again my pleasure to welcome you to this town hall. We have a very special guest today, Erin Maughan. Dr. Erin Maughan is the Director of Research for the National Association of School Nurses, where she promotes evidence-based school nursing practice. In her position, she co-leads the development of National Uniform Data Set for school nurses and for the identification of school nurse indicators. She co-led the creation of NASN's framework for 21st century school nurse practice. Dr. Maughan is also an adjunct professor at Georgetown University, where she teaches public health nursing, and with colleagues from Georgetown, co-directs a global school nurse researcher consortium. Dr. Maughan currently sits on the WHO's Technical Advisory Group of Experts on Educational Institutions and COVID-19. She recently completed service as a member of the WHO's School Health Services Guideline Development Group and has provided consultation related to school health to the WHO's office in Sierra Leone. Dr. Maughan is certified as an advanced public health nurse, is a Robert Wood Johnson Foundation Executive Nurse Fellow alumni, the 2013 cohort. Dr. Maughan is also a fellow in the National Academy of School Nurses and the American Academy of Nursing. Dr. Maughan has worked in school nursing and school health most of her career. Prior to NASN, Dr. Maughan was faculty in the College of Nursing at Brigham Young University, where she taught and coordinated public health, community nursing, and the global health nursing study abroad courses. She also studied issues related to school nurse staffing globally, publishing and presenting numerous times on the subject. Prior to BYU, Dr. Maughan worked for the Utah Department of Health as the state and adolescent school nurse consultant. She also worked as a school nurse. Dr. Maughan is passionate about addressing the needs of vulnerable populations and improving school-age children's health around the world through research and data. And it is my pleasure to introduce to you Dr. Erin Maughan. We are so excited to have you here.
Well, thank you. Thanks, Soph. And I'm excited to be here. I always love, some of you might know I am from New Hampshire, so I consider all New Englanders, anyone who lives in New England family. So it's always nice, and was mentioning the snow there because I love snow, and yeah, I miss it and don't miss it. I'm in the Washington, D.C. area where it's 50 degrees at the moment and no snow. So anyway, but thrilled to see you all. And Clayton, if you want to go ahead to the next slide, this is just an overview of what I'm going to talk about. We definitely will have time for questions at the end, but if there's burning questions, I think the chat is the best way. Yeah, I'm seeing shakes. Okay, good. I really want this to be useful and helpful for you. And so that's my goal. These are the things that I'm going to talk about. A little bit about why the role of school nursing is often misunderstood and what we can do about it. Then explaining NASN's Every Student Count initiative and what it is and the state data coordinator and how it all works. But then also at the end, Clayton asked that I also talk a little bit about other opportunities through NASN and some of our research grants. And I also wanted to throw in scholarship grants because I'm not sure if everyone always knows about them, but they're a great way to help for anyone interested in furthering their education. And then of course, there'll be time for questions. So, okay, go ahead to the next slide, please. So do you know the number of COVID cases in your county? And in particular, and because I know you're all in different counties, this is hard, we're actually gonna do a go ahead, and if you want to do the first poll question, Clayton, about COVID. The question also is, do you know how many people are hospitalized as of this morning? That's where I got this from. For COVID cases, they're in Vermont. I should say here, I guess, in Vermont for you, sorry. Let's take a second and see what you think. All right. Let's see what people thought. And these are anonymous, so it's just kind of fun to see.
It looks like some folks are still voting. So
are they? Oh, okay. We'll wait a little. It's always hard on the time thing. So I will tell you, all of those numbers I put do have a significance in COVID cases in Vermont. I wasn't trying to be tricky. I was just trying to come up with other numbers. But one of them is the number hospitalized.
Okay. We've been a minute 15. We'll go to minute 30.
Okay. Sounds good.
Well, 78% has voted. So I don't know if you can, you probably aren't able to see the results. We had 3 voted for 5, 3 voted for 25, 16 for 45, and 3 for 101.
Oh, you guys are greatly informed. If you want to go to the next slide. I'm impressed. It is, currently hospitalized 45. There you go. Thanks, Ken. So, but as you can see, some of the other numbers, hospitalized in ICU is 5. So, and I know this is a roaming number and it's sometimes hard to tell, but it relates, and you can see it's always, I'm a nerd and I like data. So, but the map, I think it tells us a lot about COVID, and not that we'll necessarily discuss it, but to me, my next question always comes up to, so how does this roll out with schools, and how many cases have been linked to schools? And what we're finding kind of nationally is that many states, they know it, but it's not necessarily tracked in a way that we can get good numbers across the entire nation. And Soph mentioned that I'm on a WHO call. Our call was this morning, actually. And this is something that we're actually finding is, I guess whenever there's a crisis, you find where the holes are. And because schools are so locally controlled, so much is unknown unless it's decided at the local level to do. And why I bring this up is also because that's what we're going to talk with every student counts of why that is. But first, to kind of lead into it, I want to just briefly mention of, why data is important at an individual level and the misunderstanding sometimes that happens. So can you do the next poll, Clayton, about what's the concern one? So what is your biggest struggle as a school nurse? And I just picked a few of them. I know there's many more, and many might apply, but just pick your biggest one, I think, because I think it'll only let you do one. So just out of curiosity, what are some of your biggest struggles as a school nurse, just in general? And thanks for whoever's putting the links in the chat. That's cool.
And I think I figured out how to share the results afterwards this time. So this is my first time doing polls, so apologize for that. Not the first one that's shared.
No, no worries. It worked. I just appreciate you doing them. Thank you. And whenever there's a good number, Clayton, feel free to share the results.
Give about 15 more seconds.
Sounds good. All righty, this is really helpful. Thank you. School to not understood. I definitely think this is a national trend, and it's something that we've struggled with a long time. In some ways, I think COVID has maybe helped with that. We did a global survey of school nurses, and lots of happening related to COVID. But if you want to look at a silver lining, the fact that all of a sudden school health is being seen bigger, and there's a lot more in the news regarding school nurses in regards to COVID, maybe not all the other roles, but this is definitely something that we've really struggled with for quite some time. And I just want to talk about one kind of, I guess you could call solution that would help. And of course, because I'm talking about data, it's about data. And I share that is that my one main goal, I think, with practicing school nurses, as you know, which I was, is that people don't know because sometimes we don't share, or we might share a story, but not share it in a context that they understand the magnitude sometimes of what is going on so that the changes can be made. And this is just human nature. We're all really busy, but that's where data comes in, and it can be so important. So if you can go to the next slide, I just want to share a couple different scenarios that not necessarily all related to misunderstanding of a school nurse, but I think are linked in many ways. The first one is, how many of you maybe have noticed that your kids, maybe more playground injuries that come in, or other injuries that there seems to be trends, and you might kind of know it from the back of your head, but there's been, and I'm going to share actual examples of how someone noticed the trend, and so really decided to take stock of the data and where the injuries were happening and what was occurring and what came from that. Or the second picture there is to represent really that, what is the role and value of a school nurse versus a secretary or an aide doing certain things? Because if they understand a school nurse giving out Band-Aids and ice, yes, others can certainly give out that. But what makes it important, and what's the difference of the critical thinking skills a school nurse has? I'm going to share a story on that. And then questions about salary or workload, or I know in Vermont there was questions with substitutes. Data can help us with all of these issues to better be able to articulate our stories, and changes have been made. So if you can go to the next slide, Clayton. I'm going to share just really briefly, and these are actually stories all from the NASN school nurse. So on the left, the playground, there was a nurse actually from Maine, and she noticed the injuries that were going on in the playground and just took stock of them, and then used that data to not only share the awareness of what was going on, but that actually was able to write a grant, and they were able to get brand new not just playground equipment, but the whole thing landscaped beautifully, because it's not always just about equipment. It could be about like uneven ground that kids were falling and tripping in holes, things like that. But it all started because a nurse saw the need, which we see all the time, and then got the data and made the change. That's what data can do. The second one, and this comes, I'm going to talk, this is from Every Student Counts data. And yes, you see Claire there, a big story, that'll be the third one. But the one in the middle first. So health office visits, this is the only outcome data we have currently with Every Student Counts. But we're looking to get more. But the big thing, and this is actually a story, and it's published in the NASN School Nurse. We're trying to do stories about data for the past year or so. So it's common knowledge. This was in Alaska, so I can share. And this was a nurse that noticed, and she was a supervisor. So I was looking at nurses in her area and noticed that this school nurses were sending kids home at the same rate as the secretary, because the nurse isn't always in the school. And so she looked at it and she called the nurses together to look at it and was like, you know what, we always say that a big difference of having a nurse versus like a secretary is the fact that we have critical thinking skills and nursing skills that triage, that we might be able to do something so that the child or youth can stay in school and not be sent home. But when our rates are looking the exact same, they actually used it as a quality improvement, and they identified some things that they could do some training. So some of the school nurses hadn't felt comfortable. So they figured, when in doubt, just send them home, which sometimes that's okay. But there are things like they did a class with assessment skills again. So it was able to see, now these are not Alaska, these are national skills, national data. But you can see the national data trends tend to show that if a student is seen by a registered nurse, they're more likely to stay in school. That's the blue. You can see it's broken down by LPN and aide. And this is really a critical thing, because as you know, I know I'm talking to the choir here, we can say, well, if you're a nurse, they stay in class. But if we have the data that can actually show this, this is very powerful and can make huge changes in having school nurses, and it has. Now, does it always happen? No. I mean, this is the real world, but it's going to be more likely to happen if we have the data to show that. And that's why we collect this data point in particularly, so that we can see nationally where this thing's. But in this situation, it was also a nice quality improvement check for the nurses to see from their own practice what could be done to better show the critical thinking skills. And then finally, the last one, if you remember, was about salary. And this again is written up in the NASN School Nurse, and Claire shared it with us, is a concern. Actually, it was with substitutes and not being able to get substitutes. And so substitute school nurses, I should clarify. And I'm just going to high brief. Claire could fill in if I mess this up. Hopefully I won't. But the idea is basically there was a real problem. So Claire and others kept track of the number of times when they couldn't get a substitute and asked reasons why. And it came up clear several of the main reasons, and they were able to use that data to go to the school board to explain when they were being paid minute amounts, they couldn't really get the people to come. And so it didn't fix it that they're getting huge amounts now, I realize, but it improved. And so it was because of the data. So it wasn't just looking like a nurse is complaining, but they actually had the data to show that this was a real issue. So these are just a few examples, and there's many more, but this is the power of data and how we can use data to show our role. Now, just out of curiosity, I'm just gonna, can we do the third poll now, about COVID, Clayton, please? And yes, Claire, I'm sure that story when she was the director, that's how I knew it, so thank you, yeah. So, and this is, again, this is anonymous. We haven't really talked about this, but bringing back into COVID, are you collecting anything different because of COVID? Or I know you're all running as fast as you possibly can, so I get this isn't a judgment call, it's more a self-reflection. So just kind of curious where you're at with it. And Clayton, whenever you want, feel free to show the results.
We'll go 15 more seconds.
Yep, sounds great. Okay, great. Many of you are, some are not. And again, I get that. I just am throwing out, this is a great opportunity of being able to show some of the things and the impact that school nurses have. At the end, I'd love to hear some of the things you're collecting too, just because I think we always can share and learn from each other. But this idea of collecting and using data at the local level is just so important. Now I want to bring it up to how it can be used at the state and even the national level. Just today, I heard someone shared a story with me about some concerns with COVID. And so this is a state consultant in one of the states. And she's been doing a series of just a few questions, is my understanding, about some of the current concerns they've had. Because sometimes, because districts are local controlled, sometimes they talk, but not always. And so a school nurse might see something and they're like, well, they're really concerned, but the district's like, well, yeah, it's really not a big deal, just deal with it kind of thing. So they actually did a poll and they actually had the numbers for their state. Now, not everyone necessarily contributed every time, but it's growing. And now there's data that the school nurses, and she's able to use, that are armed to show that this isn't just an issue in one area. And that actually are armed to show that it's an issue across many. And one thing she reflected, is why I want to share this too, is that it also showed how informed the school nurses were. That because they had the data and it shows that they're staying on top of things, not just for themselves, but for others, by a data point that others are collecting for them, but she's able to share so that school nurses can use it for the work that they're doing there. And so it can be used at the state level as well. And then nationally, when we can pull all our data together, if we collect it the same way, and that's the key point, there's a ton we can do with it. And I'll talk you a little bit more at that. But first I want to show a video. If you can switch to that, Clayton. And thank you as I do all these changes. This is just about a 2.5 minute, but explains what every student counts is, I think, better than me blabbing on. And so this just introduces it.
How can you tell your school nursing story? Would you believe it's by using data? The National Association of School Nurses Data Initiative, the National School Health Dataset, Every Student Counts, encourages school nurses around the country to collect data that describes what they do to improve the health of students and the community. School nurses should use the data they collect to better understand their school community. Data identify trends, such as students coming to the health office with specific complaints or on specific days or months. The data tells a story to share with administrators, principals, teachers, parents, and other stakeholders about the types of activities that school nurses do to keep students healthy. By collecting data points that share the same definition across districts, regions, and states, data from individual school nurses can be combined to create a national data set. That is where the initiative gets its name, the National School Health Dataset, Every Student Counts. So why bring data together? There is power in numbers, the data, and a larger representation of school nurses. The school nursing data story can help advocate local, state, and national student health policies with real data, real numbers of students' health concerns, and information on how schools are managing those conditions. as well as look at those schools with nurses and those without. The more schools that participate in the National School Health Dataset, Every Student Counts, the more school nurses will have benchmarks to measure how school nurse interventions and student activities compare with similar schools across the state or country. Analysis of the dataset will identify best practices in school health to better support students' needs, creating the evidence for high-quality school nursing practice. Without data, you are just another person with an opinion. Data is needed to inform and validate best practice. It's how we tell our story with impact and credibility. Join us in creating the National School Health Dataset, Every Student Counts. Remember, the data entered in the dataset is de-identified. It cannot be traced back to individual students. Data privacy will be strictly followed. Learn more at nasn.org/Every Student Counts.
Great, thank you. So that kind of gives an overview of the program, and hopefully, well, I'm going to share just a little bit more, and then if you have questions, I'm happy to answer about them. But really want to emphasize again, even though it's a national school health data set, the data is so important, and the initiative really focuses on using the data locally and then at the state. And I know Sharon Lee and now Caitlin really have used the data many ways. It just, there's power in numbers and there's power in data. So gotta love that. So you can go to the next slide, please, Clayton. So I just wanna, oh, and the next one, sorry, this was just to remind me about the video. So there's basically 3 parts to this initiative, and I'm gonna just briefly talk about each one. So if you can go to the next one, the school nurse capacity building, this is, can be done in many ways. So I mentioned the articles that in the NASN School Nurse, there's been a series for about 3 years. Every issue has something related to data that can be used. Some of them are stories, some of them are little like quick skill set things, some update on what's going on. But there's also some webinars that if you're a NASN member, there's free. I think it does cost if you're not, but there's all kinds of different topics that can be used. The fact we're doing this now, thanks for inviting me. I'm happy to do things that the idea is just numbers are good, but numbers need to be really accurate. We can't guess on them. And we just need to feel more confident using data. Depending on when you went to nursing school, you may or may not have emphasized, I know when I went to nursing school, that we emphasized evidence, but not at this level. So it's gotta be, it's partly something we just have to just be confident and say, you know, I'm gonna do this. And it's not gonna be perfect the first time. It might not be perfect the 10th time, but we're working on it and we're moving and we're learning from it. And that's really an important part of this. And because every state is at a different spot, just because Massachusetts is close, you might know that Massachusetts has been collecting data for many years as part of a grant that they have for certain of their schools. So that's different. Don't compare yourself there. I'm just using it as an example here. And because every state is different, every state has at least 1, if not 2, state data coordinators. And the role of this data coordinator is to kind of help be the point person for that state. They can advocate for having, like when you have your conferences or doing different trainings or like things like this, to have a discussion about data wherever you're at. And also later on when we talk about collecting of data, they're the point person about that and how it's going to be done. There's lots of different roles, but the idea is because every state is different, we aren't dictating how any state has to do it. We're providing the information on the data points, and then there's a lot where it can be run with. Although I also realize everyone's doing a lot of things, but that's just kind of how this building of capacity is just really important. Okay, can you go to the next slide, please? And so the data points, we keep talking, everyone collecting data the same way. These are an overview of what the current data points are. If you go to the website, the same one that has the video that was shown, that's the front page of it, it actually gives the exact definitions of each of these data points, because that's the critical component of this, is we need to identify what, and you can say, well, why, you know, one thing I know is glaringly not on here, mental health, that's huge. This is a beginning point. We started this just a few years ago and we're building as we go, and we want to identify low-hanging fruit, things you most likely were collecting already, except I know health office visit may not be, and so that you can grow from it. And if you don't collect all of these now, that's okay. Start with what you are collecting. This is all part of a process. We do have, because NASN has a contract with the CDC, you'll notice, you might wonder, of diagnosed chronic conditions, MECFS. That stands for, and I hope I pronounce this right, myalgic encephalitis, chronic fatigue syndrome. They, from the CDC, gave us a $3.1 million contract if we would give information about MECFS and include that as a list of if it's been diagnosed. It's very underdiagnosed. It's really about trying to get the word out and being aware of it, but they also provided money for us to help build the platform, which I'll talk about next. So that's why that one's on there, and maybe mental health is not at the moment, but we're going through a process to identify what other data points will be on there, and very strategic, because this isn't going to be every data point you've ever collected as a school nurse. There might be other things that you want to collect in Vermont that aren't on here. That's totally fine. Many states do that. And this isn't to everything you do. The purpose of this data set is to get things that across the country, so it's got to be relevant across the country, that we can use and thoughtfully think. There's a lot of new statistical tools and analysis that can be done with predictive analytics. You might have heard of like artificial intelligence. That's all just data that predicts things. And also there's factor analysis, which is the ability to look at things to identify what are the factors, for example, that give us the best outcomes. The only outcome data we have is health office visits. We'll get more. This would help us better identify and show why, in our opinion, right now, it truly is an opinion, like the video said, that we need a school nurse in every school or access to a school nurse. That is an opinion. As much as we like it, that is not a fact. I'm a data person with fact. Well, how are we going to get that to be a fact? We're going to collect the data that helps us identify the factors that make it improve better outcomes, that make both in health and academics, that will help educators understand what the role of the school nurse is. And if it's not exactly what we think it is now, it also helps us as things change to better understand things. These are the kind of things we can do when we have a large enough data set that all the data we can do research on it. So it's really critical we use the same definitions. Those definitions are on the webpage. I'm not going to read them at this time, but that's the second part, is identifying these data points. And then if you want to go to the third slide, Clayton, please. Oh, shoot, forgot about this. So this is what do we do with the data? So the data is collected, and at this point, it's been collected at the state level, or I'm sorry, like at the district level, and then it goes to the state, and the state then submits data aggregately to the nation. We always publish it just, we publish the data aggregately. So this map is showing what the tiers are, which I'll talk about in 1 minute. The exciting news is that all states are participating in Every Student Counts at some level. We have 3 tiers. Tier 3 is that their whole state is including private schools, and they have a data set. Those are your states that have been collecting data for a really long time. Tier 1 is the first one, where it's beginning point. And you can see the far majority of the states are still more at the beginning stage of getting a system and a way to collect data. And that's where Vermont is. And that's great because you're on there. It's a beginning point, and that's the only thing we track and show by state. Everything else on here with data is aggregate. Never are we going to say Vermont has worse data or better data than you pick the state. I'm not trying to compare anybody. That's not our purpose here. We're trying to get it aggregately. So I just want to verify, because there's been concerns about that. So I just wanted to share. But we always share back, and I will tell you, this is hot off the press. It's actually going to be published in the March issue of the NASN School Nurse. It hasn't actually even been put down. I went to get it from our website, and it hasn't even been posted yet. It will be soon, but it's out there, and our data coordinators have it. So I thought I would just share. But these are our data from this past year, so you can kind of see where things are at. There's also a fillable version, so that that has the national data, and you can put your data in so that you can use it at your local level to show similarities, differences, etc. Every year we always do this because it's important to us. If you share the data, it's your data. You share it, we're going to share it back to you so you can see how it's used. And how do we use it? Well, we use it for advocacy. We start sharing the story of what's going on. And you can see I already shared how we use the health office visits one quite a bit to show of the role of the nurse. Okay, now go to the next slide, please. And I'm watching the time, don't worry. So the third area is our data infrastructure. I mentioned before when we started this, and it really is still up to every state because every state is different. But a lot of states, especially in tier 1, one of the big concerns is that there really wasn't a structure for collecting data. And so nurses were spending a lot of time either having to type it into an Excel or even just handwrite and then send it to someone. So with the money, as I mentioned from the CDC contract, we've actually been able to develop a brand new platform. And this is just a screenshot. It is being launched this year. I know COVID wasn't intentional. None of us knew COVID was happening. So this was, but it's available. There are still options, but what this platform allows is that you at your school level can enter your data just directly into the platform, and it will aggregate it at the district level, it'll aggregate it at the state level, and then it brings it into the national one. There are safeguards, so I can't go in and look and see what Clayton's school has, what he's put in, and I can't see what SOFA's done either. So there's all the safeguards. There's not a way, it's very secure. We've worked with lawyers to make sure that we're following, and it's FERPA compliant, HIPAA compliant, all of those. And at the same time, it allows for us to collect data easier in most states. Now, states that have their own data system or are collecting other information, it can still be submitted at the state level, or if your district you feel better have, or there you have it collected at a district level, you can still submit it that way too. There's lots of options. But we're really excited about this because down the road, when we get the data in there, we'd be able to see, and I can't remember what level of school. So say I worked in all levels of school because I covered multiple, but I worked mostly in elementary schools. So I could go in and say, okay, my elementary school, I've put my data in and it shows the number of students with asthma and seizures, et cetera. I can then run a report that says, how does my school compare to the other elementary schools in the district I was in? I was in a huge district. And how does that compare with the state? Or how does that compare with other elementary schools across the United States? It's not going to point out each one, but it gives us, and you can do it with a high school, or you can do it with an urban school versus a rural school, or a nurse that is one nurse in every school versus a nurse that covers multiple schools, or nurses that have more free and reduced lunch, students with a free and reduced lunch. All these demographics, you'll be actually able to see how you compare, meaning as a benchmark, with other schools, which can be used to your advantage greatly in being able to show maybe why resources are needed or what's needed. And eventually we'd like to be able to run these so that you could actually print them off by your congressional district, so that when you're advocating at the local level as well as at the state level, you have your exact data for your county, however it's split up in the state. So they can't say, well, that's nice, but you know, we're different here. We have your data and you can tell your story that much more powerfully. That's what is the great potential of this data platform. But we're just launching it now and it's being rolled out. But that's the exciting thing. Okay, go ahead, go to the next slide. So that's basically what Every Student Counts is about. I've mentioned from the map, you can see the various tiers. This is, sorry, everyone's starting and it's at the state level all the way to the local level. Start where you're at. I think that's a really another important thing. This isn't meant as a pressure thing, but if we don't start today, it's never gonna move one step forward. We're always gonna be wishing and not having the data that we need. And so this is how it works. And we just invite you to participate. I'm just gonna, I'll answer any questions that you have about that in just a minute. I just have just a couple more slides of what other things going on at NASN. I think maybe it might be easier if I just do it all and then we'll open it up for questions. But that's kind of what this is all about. And I'm happy to answer questions on it. So Clayton, can you go to the next slide? Just briefly, because there's a question of, well, what else does NASN do regarding research data or other things? So I just wanted to share a few. This is just actually pretty new as well, but now this is if you're a NASN member, I realize, sorry. But if you are a NASN member, you can get the Journal of School Nursing online. You've always been able to, but it's going to be only published online, actually in January, starting now. But what's nice about it too, is that there's this, what they call it, a research center, where abstracts from other journals that SAGE publishes, SAGE is the publisher for the Journal of School Nurse, that seem relevant to child health, they have abstracts of their of those other research articles. One of the things that's always hard is to know what else is going on. And here is an opportunity, anyway, here's another opportunity that where we have access to more evidence. So just wanted to give you a heads up on that. The other thing is that if you want to go ahead and go to the next slide, NASN does have research grants, and they are for research, and at the same time, they can be for scholarly projects. So if you have something that you'd like to work on, there are opportunities. They're due the end October 31st of every year. Sometimes we have special requests, especially for data that's already been collected that we want to do some analysis on. We'll probably do that for COVID this year. So there are those research opportunities out there. To be eligible, one member of your research team has to be a NASN member. Again, just because this is money that comes from the National Endowment that submit. I also just want to highlight that there are also scholarships for education. If you want to go on to school and or take some classes and things, I really encourage you to look at the scholarships that are available, because it's a nice way. I know school gets really expensive. They're also due more in the fall, but just another thing to be aware of. I just wanted to make sure you knew of. Okay, if you can go to the next slide. If you want to know what NASN is doing on research, we developed a research trajectory where we're trying to be very strategic, not just with every student counts, but I think this is, I know I'm a nerd, but the question came was, is if we want to change policy to really improve child health and get more school nurses, what data do we need? So instead of just saying, well, we just need data on school nurses and we need data on this subject and this subject, which is all true, that's not going to advance our profession as school nurses. So we very deliberately, and it was a huge process. If you're interested, I'll share later. I won't share now. We did a huge process to identify what are the data points we need to make the policy changes we need and want. And then we backed it up to, so what research projects do we need? And then we developed a plan on how to get there. If you want to go to the next slide. We have it all mapped out. I won't show you that, but this is the condensed version of the different things and the different research areas that we need in place. And these really then prompt our priorities and help guide those of you that are in school that are doing particularly research projects or other ones. We always have lists of projects that would be helpful if your schools allow them, that could help. So that's the other thing. And I think that's all. So if you want to just go to the next slide, I always like to end with a quote, because I just think, I think if we understand and we see our data, COVID has really increased that what others view. We always had we knew of our worth. But when we really understand our worth and we have the data to show it, we move differently. And that's what I just really encourage us to do individually, but collectively. We all learn, we're all learning. And if we continue to move forward and use our data, I know we can make a difference that we want to for our kids. So thank you. That was all.
Thank you very much, Erin. If you have a question, if you right-click on the participants at the bottom of your screen, you should be able to click on a button that says raise hand, and then I will call on you in the order of the raised hands, please.
And so while folks are doing that, I wanted to just mention that data coordinators, so Claire Molnar and Sharon Lee and I have all been working some on the data coordinator piece of that. And all of us have been, well, with everyone else with COVID, not able to do very much with that. And I think that it might be a great time, actually having done this presentation, if anybody would be interested in being the state data coordinator, they could email Erin directly and let her know. And there's information on the NASN website that explains it in a little bit more detail, but it'd be really great if we can have two, right, Erin?
Yes.
I think, yeah. So it would be great if we had two that could really manage that. And then with Sharon Lee being retired, I'm sure she has all kinds of free time that she can probably start doing that, you know. But I think that, and Claire being retired, maybe not, she doesn't have, and nobody has spare time. So it'd be really awesome if we had some folks that wanted to step up. It's a great leadership opportunity. And it would really help Vermont get our data into the national data. So I just wanted to make sure that everyone knew that there is opportunity there, and anybody that's willing to step forward could email me or they can email Erin, and we can make sure we make that connection. So thanks.
Yeah, and just to add on to this, there's not a qualification that you have to have a ton of it. If you do, that's fantastic. But sometimes those that are just interested in data don't feel like they are qualified and don't step up. And there is no qualification. Your only qualification is if you are willing and are able to, because I know everyone's time is busy, but we provide training for you. Again, you're not analyzing the data unless that's something you want to do, but that's not a requirement on our end. It's just, it's more coordinating and being the advocate for data and use of data. we can have two official ones, but then also if there's others as well, we really encourage each state to kind of actually have a team to make it so it's not a huge burden on anyone in getting the words out. For example, like by region or something, Georgia always comes to mind that they have set up theirs. They have their data coordinator, and then they have the different counties and regions with a team member who can push the information out directly and then receive it. Sometimes people felt more comfortable doing it that way. There's no right or wrong way. There's lots of ways to do it. And so just sharing that. And like I say, happy to share. I'm actually working on an orientation video for the data coordinators. So if that helps at all, or if you just want to learn more about data, this might be the way to do it as well.
I think Sharon, I was going to say Sharon Lee might have something to share on this also.
Yeah, I think I was excited years ago when we started this project because a lot of people did participate, and we did it for 3 or 4 years, and folks really each year there were more and more school nurses who participated. I think they really liked it when they were able to enter things directly, but we were able to get information in and submit it to NASN. We were up to about 20% of school nurses participating in Vermont. So we have a good basis to start with. And some of you are on now, but it's always a great place. And I'm sure Claire and I could be more than happy to help you work through some of the questions.
And thank you for that, Sharon Lee, and Claire also. And Claire, if you need access, I think that Erin can make sure you have the appropriate access to be able to continue to do that, because I think that having that base knowledge would be really helpful moving forward.
Yeah, for sure.
Now, I just want to say that you all do make data sound fun. So
it really is.
For the school nurses that are on this call and those that are going to be watching later on, sometimes folks are looking for a way to get involved, but they don't want to be visible. They don't want to be in the front of the crowd. This is a great opportunity to do some very valuable work and not have to be in front of people if that's a concern. And I'm really especially grateful for we all work better when we have a partner, don't we? When we have somebody to lean on, especially as we're learning new things. So I do hope that someone will reach out and see what kind of data we can get from the state of Vermont and where it leads us.
Erin, Dr. Maughan, it's been a real pleasure to have you share your message again. I always delight in the importance of how data can tell stories. So thank you very much for this. And it's really a thrill to see the new platform. I think that's going to avoid some of the questions that we had earlier. And I also hope that you have this chance to meet our new state school nurse consultant. Caitlin Cotis is on, and I believe you met her previously. I'll let the two of you share that connection, but we're really delighted to have Caitlin join the health department. I am watching from the outside at this point, but also very proud to have worked with Nathaniel Waite. I can't elevate his name high enough. He's such a strong advocate for school nursing, more than many of you realize, because it's so much behind the scenes. But he's on, and he has expressed an interest, I saw in the chat, to support data collection.
And honestly, I'm thrilled to see that, because I think one of the, I get that kind of higher level because I see what all the states, and I think the states that have the most success are the ones that have that partnership with the state, like having Lynn Sharon Lee. That was just sincere gratitude, that because I know I was a state consultant years ago, and I know it's a very busy job, but I know how important it is. And I'll be honest, so I was a school nurse, and then I went back to school. That's how I got interested in the data. So just also, that's another thing I want to say. It wasn't like I'm one of these data wonks. If you are, that's fantastic too. But I did it truly out of the necessity. I saw a need. I loved what I did, but I knew I was covering way too much to make the impact I wanted. So that actually was what put me on the trajectory and why I actually went back to get my doctorate. So, and then I went and worked for the state. So that worked well. But I think the partnership back with Caitlin and Nathaniel for if that I think would be great, because one, I failed to mention, but one of our other bigger, larger goals is not just to have this data set as this, like for us, for school nurses, but with electronics nowadays, there are so many possibilities of how can we pull in data from other data sets to get an even bigger picture and better picture, deeper picture of what is going on with children, and to know how best to help them and utilize them. And I think the partnerships with states are so important. Plus, at least for me, I know I worked in the Maternal Child Health Bureau. The data we collected in school nursing was very valuable for reports and things that were going on. And I see Sharon Lee shaking her head too. Yeah, so it's a win-win. So we really encourage that, and I'd be happy to talk to you guys about how that would work. Yeah, and with EHRs, again, that's another thing with the platform right now, it is hand entering, but we are working on getting different ways for it electronically to be, I call it dumped, from an electronic health record, so that it, or, you know, sent through, so that would save a tremendous amount of time for those of you that have electronic health records. The other thing is it also decreases error, because every time you enter it, there's a chance, even though you're all wonderful, I know I have big fingers, where I hit a 5 and a 6, and I'm trying to say there's 5 people that have it, and all of a sudden it says there's 56 that have it, there's a problem. And so being to incorporate the electronic health records is one of the things we're working on now.
And Erin, I would add that the infographic that you had shown during the presentation, those types of things, if we could have them from the state level, when we're trying to show proof of why we need certain things with school nursing, keeping a school nurse in every school, not just with COVID, but in the future, we would be able to have that data collected in a way where it would be meaningful, and we can use that to give to the legislature, or to, and because then I take some of this data when we look at it nationally as director and going to Capitol Hill, although virtually this year, but being able to then talk with Bernie Sanders and Patrick Leahy and Peter Welsh using the national data, but it's always nice to tie in the Vermont data too, so we can keep it local and keep those stories so they think about us here in the state, not just on the national level.
Mm-hmm. Definitely. I just have to say shout out to Bernie Sanders and his mittens yesterday. I liked them.
So I see that, so Lisa put in, she'd like to get more information about the data sets. And Erin, could you talk a little more about like the actual platform? Because I remember seeing some of the architecture, just pictures of it when we were talking at some of the meetings earlier in the year. But is it almost ready to be launched, or is there at least a shell that people can look at and get an idea of what it's looking for and maybe how that data is going to be input?
Sure, yeah, so it is ready to, in fact, it launched the end of last year. It's just because of COVID, we didn't do the huge launch we had planned. Actually, this week, the state data coordinators will all get their registration so that they can start getting in. Because, and why we have to do it this way is because to keep the security where we want it, we can't just have anyone say, oh yeah, I want to be, and I'm just making this school up, but I want to go in for Rock Creek Elementary School. Well, should I be going in for Rock Creek Elementary School? And so we have these safeguards in place, and it begins by first having our state data coordinators register. So we do collect name. I do want to be very clear, because the data wonk in me is that even though your name goes in connected to your school, that's for you for future years. It actually is recoded. We don't ever see that. We worked really hard with our platform company on that, just in case that's a concern. But anyway, once we get our data coordinators in there, then they also decide if the state is going to submit it individually at the local level, or if they want to submit it at the state level or the district level, because again, every state is different. Once that's been set up, and there are some other great easily way things that then we can start, and school nurses can start registering in the system at any time. I only have the mocked frames at the moment, just it's live, but just because there's no data in there. So yeah, but we had quite a few people test it. So it's a pretty user-friendly, and I'm happy to do, and we're getting some video versions of it, but I'm also happy to do a live run through if that would help in the future to show exactly. You don't have to enter all your data at once. Two other things that are kind of neat about the platform, and again, you get to choose these things, is that eventually not only can you submit it at the state, at your school level, you could actually submit it by grade. And that's where we really want to make sure the security was in place. So again, you could look to see how our 4th graders across the nation, or how our 10th graders, it brings us so much more capability, the more granular level that we can go with data. So down the road, all of those will be possibilities, as well as if, like, for health office visits or chronic absenteeism, you could actually submit your data in monthly. You don't have to, right now we just submit it one time at the end of the school year. You can still do that, but there's a lot more opportunities, and I'd be happy to do a time to show you how that works. The data points are the same, and the data points, like I say, are on the Every Student Counts webpage. I can pull it up if you want, and I can show you those, what the definitions are. And if you aren't doing it, oh, you got it. Okay, great.
Yep.
I would say I think the staffing would probably be easiest, because you probably know that. So even if you want to just start with that one, that's a beginning point, and then work towards the other ones. Or if you know some of the chronic conditions, but not all the ones listed there, that's okay. It's very flexible.
Which one did you want to look at?
If you just want to go to the NASN.org, the step Every Student Counts, I was just going to show if they wanted to see where the data points are. While you're doing that, Sharon Lee makes a really good point. Anyone interested to contact Clayton so they can get kind of the group together too. Also for your data coordinator, you can let me know too, but it's really up to your state. Like, I don't choose or qualify anybody. It's who you as a state really want, so we can work together on that. So here's the main website. You can see where the video is. And if you just click on uniform data points, it's on the right there. It'll bring you to the page, and there's several different versions. So we have frequently asked questions that we get a lot, so we did that there. And then those are about the definitions, but you can see the definition document. And I warn you, it looks a little busy because we want it to be very clear, but you'll see a lot of repetition, but it makes it really clear what each data point means, so that you're really clear when you're collecting it, that you do it the way it's outlined. And so these are the staffing data points for school health staffing. And for example, if you don't have an LPN or some of these positions, you can just leave it 0. Remember that these data points have to go across the nation, and in some places they work and they have a lot of LPNs in this, or LVNs in the schools. So some of these apply and some of them don't, and that's okay. So it basically asks about like direct care, and then if you're a float or a like special assignment or an administration. Those are the breakdowns of the school nurse staffing data points, broken down by if you're a registered nurse, LPN, or a non-nurse, so like an aide. And when I say you, it's actually you're reporting for example, your whole school, or if you're reporting for your district, it would be your whole district, not just who you are. It's meant to be, so if you're working in a school and you have an LPN or aide that's working with you that follows this definition, then you would report those positions, both yours and the person that you're working with, because we're trying to get a better feel for who's working with the children, not just one person's position. So those are the, it looks like a lot, but like I say, it's just broken down by different categories, depending on what's going on in your school.
Sharon Lee's hands up, and she also put the link to that directly into the chat box.
Sounds great.
Thank you, Clayton. Okay, my hand's lowered. Nate has reminded me that you all are currently, and maybe I've not shared this message clearly enough at NASN and NASN, but Vermont school nurses have been involved in a quality improvement project since I want to say the 90s. Every year, we annually report the number of students who have insurance, who have had a well care visit, and have had an annual dental exam. And we also collect information on asthma. So that is directly related to showing to our state Medicaid office that this is the work that school nurses are doing to really ensure that kids get access to it and use high quality health care.
Great.
Thank you. That's really great. Erin, thank you so much for being here and sharing all of your wisdom and excitement about data and what we can do with it. It really is a treat. And hopefully we'll see you again soon.
Yes, that'd be great.
Thanks, everybody. This will be recorded and, has been recorded and will be up on the website for you and those who did not get a chance to see it to view. Send any questions about data and desires about data coordination to Clayton. All right. Thanks, everybody.
Thank you, Erin.
Stay safe, everyone. Thank you.
So grateful, Erin. Thank you.
Oh, my pleasure. It's my pleasure for sure. Bye-bye.